Welcome, everyone, to the continued discussion around how we can continue to be more mission aligned and intentional as we approach the incorporation of equity around climate and environmental issues into our community investment, community health, population health work. We have three great panelists, and what we're going to do is have each one of them in kind of a slam style, just spend a few minutes, not a lot of time, talking about a little bit about the work that their organization is doing, and then we're going to have discussion. So I certainly have some structured discussion questions that I can use to get us started, but I really, again, encourage you all to talk to us, talk to each other via the chat function as well. So we have with us today Angela McDonald from the Christus Health System, Colette Barrett from Our Lady of the Lakes in Louisiana, and Greg Zucca from MetroHealth. And I guess I never really told them what order we were going in, so I'm going to go in alphabetical order by first name. So Angela, let's start with you. Tell us a little bit about the work that you're doing and the work that Christus is doing as it relates to incorporating environment into that equity lens.
Okay, so I'm Angela MacDonald, and I serve as System Director for Mission Integration within Christus Health. I'm broadcasting in Texas. Our headquarters is in Irving. And I have been working with our supply chain and our facilities groups to try to streamline what our understanding is around environmental stewardship in a more collaborative manner. We have been working towards Energy Star certification for our buildings in the United States. We have been looking for comparable certification in our Latin American ministries, which we've been able to identify. And we also have a financial allocation available to us that's allowed us to move forward a couple of projects around environmental stewardship as well, in the form of community gardens, some virtual reality experiences for seniors, and continuing to cultivate more green space in some of our underserved areas in the Northeast Texas vicinity.
Great, thanks so much. We'll go to Colette next. Tell us a little bit about your organization, Colette.
Thank you, and thank you all for choosing to join this group about community benefit. Colette Barrett, I serve as the Vice President of Mission at Our Lady of the Lake Regional Medical Center in Baton Rouge, Louisiana. We are part of the Franciscan Missionary of Our Lady Health System. It's a small system in Louisiana and Mississippi. I also serve as the chairman of the board of the Mayor's Healthy City Initiative here in Baton Rouge, which is a community collaborative that focuses on population health. We are a mid-sized city without a public health department. And so many years ago, we came together as a community and said, we're going to create a collaborative model so that we can step in the shoes of public health and make sure that we have a healthier city. And so I have chaired that board since its inception. What's different about it, and that you'll hear through some of my comments, is that we were the only joint community health needs assessment in 2015 that also had a joint implementation plan. This is all 5 competing hospitals in the community agreed on the top priorities and the single implementation plan that we reported data into and housed publicly. So that shows a level of collaboration and communication, and that'll be sort of a theme through the rest of the work that I bring forward today with you guys.
Great, thanks. Greg, tell us a little bit about the work of MetroHealth in Cleveland, home of the Cleveland Browns.
Right, it took every inch of my being not to give you a shout out there. Good afternoon. My name is Greg Zucca. I'm the Director of Economic and Community Transformation for the MetroHealth System. As Nancy said, we're based in Cleveland, Ohio. We are a public hospital serving the Northeast Ohio region. We were founded in 1837, so we're actually one of the oldest institutions in the city of Cleveland. And really, we're in the midst of a transformation of our health system. And it kind of started off with a major investment in our facilities at our main campus. So we started a $1 billion investment in our main campus to upgrade our facilities, that many of which were functionally obsolete buildings that were 100 years old or more. And as part of that, though, we knew that really healthcare doesn't just occur in the four walls of a hospital or the doctor's office. And we really looked to see ways that we can really address the social determinants of health in a much broader perspective and look at the health and well-being of the neighborhoods that we served, and looking at it from a lens of health, equity, and sustainability. And so one of the things that we did as part of this work, understanding that it was going to require a lot of collaboration and partnerships, we pursued a process called the Eco-District Certification, which is a collective impact model that requires several partners to come together to look at various different issues such as housing, access to jobs, transportation, access to green space. And so just last month, we actually received our Eco-District certification, and we are the first healthcare anchored eco-district in the nation. And so really what this is doing is it's all about partnerships and collaboration and how we really address some of these social determinants of health in the broader community and the broader neighborhood.
Okay, thanks, Greg. So as I said, get your questions or your suggestions or your ideas of what you all are working on in your own communities in the chat. We'd love to hear from you. We've done some talking behind the scenes in preparation for today and want to pull out some of the things that have really came up in our conversation around three very different approaches and three different types of systems. One thing that really came through as we were talking about how environment needs to be more intentionally part of the work that we do in and with our communities is being more intentional in de-siloing within our own organizations, right? And understanding who else in our organization folks should be talking to. So who is it that our community health team should be integrating with or talking to in ways that perhaps they aren't today? So wonder if you have some comments on that or what you've seen in your own organization as environment becomes more of what you focus on. Who else are your teammates that you've discovered internally? So Colette, I'm going to start with you.
Thank you. Unfortunately, Louisiana, we certainly have the opportunity to test our emergency management plans on a pretty consistent basis and test them really, really hard. And so collaborating with community stakeholders, understanding who the partners are in our community is something that happens all year long. It's not just when you get ready to dust off your emergency management plan for your annual review that you figure out who's leading what organizations. It really is an ongoing relationship development. An example is in April, because hurricane season starts June 1st. So in April, we'll host an all entity meeting where we bring all the leads, not just from within our own ministry in our region, but urgent care centers, freestanding surgical hospitals, other people in the community who may not be connected to others. And we host this summit where we exchange information, contacts, and we share the resources that we've created with the state on how to prepare during hurricane season so that when or if a situation occurs, that's not the time to create a relationship. It's not the time to figure out who you need to call or build the trust for how you make those decisions. The other thing that I think is really important is that hospitals, we do these hazard vulnerability assessments every year. It's a requirement, right? Our emergency, our environment of care assessments. What about the HVAs that the state public health department does? The state public health departments in your states do hazard vulnerability assessments, understanding what they've identified as environmental issues within the community helps us to identify who we need to make sure we have deeper, richer partnerships with. On our state HVA, we have a nuclear power plant within 40 miles from us. We have, the chemical corridor. We have a port in our city. All of those are identified by the state as critical infrastructures that are vulnerable. And so making sure we have relationships and we have plans on how to work with each of those entities is really, really important. That's the environmental stewardship of taking care of looking at emergencies.
Right. Greg or Angela, what would you say to that same question in your own organizations? Thinking of bringing the environment to more intentional focus, what silos has that caused you to reassess or to take down?
Well, for my organization, these last 20 months have made room for a lot of research on my part. I'm in the system office, so so my relationships with our hospitals is important. And the relationships with our mission leaders who are very passionate about ecological stewardship, but are exhausted from these last 20 months. Being able to be their hands and feet on the phone, making sure that the certain vendors are, still doing what they're supposed to be doing in the, relative to the environment, et cetera. Other silos included just communicating more with our facilities. And because, for example, with the Energy Star certification, we actually had 3 or 4 facilities on deck to be certified, but because of the pandemic, the engineers were not able to go in. But being able to kind of keep people energized and encouraged amid all of this has been a huge lift. So just continuing to build those relationships. So as soon as we can go outside, we can continue to do the recycling. We can, pick up the trash, but keeping people mindful of the fact that while we're not able to meet, we're doing other things. And so I took an opportunity to work with some of our vendors that work with medical the reprocessing of medical single-use equipment, and had them kind of record a video so that our leaders could see that work was still continuing despite the fact that we weren't really able to meet. So being creative about how to continue to help people gel amid all of this has kind of been one of the things that I've been able to pull off.
Okay. And Greg, I know you talked about your green space development and, and that's something that takes more than one department and more than just kind of the planners. So how did that cause you all to act differently internally or to form different types of teams that others could learn from?
Sure. So I would say that this work of working out and beyond the campus really requires both an internal and external breaking down of silos. Internally, working with our facilities colleagues and facilities, and also our colleagues that are on the more clinical side, as they're working with patients that are facing housing insecurity issues, and bringing in the whole concept of addressing here in Cleveland, addressing the lead paint issue as it relates to housing. Externally, it really required us to work with those types of organizations and community development organizations that typically, hospitals don't do a lot of interaction with around kind of making investments in a neighborhood or in a community. And so really what we did was we created a stakeholder group, external stakeholder group that included many of our internal folks as well, to really look at if we're going to try to address some of these issues of equity and environment and sustainability in the neighborhood. How do we do this as a partnership? How do we do this as a collaboration? And really what that led to was the process of doing a neighborhood master plan that we did in connection with the city of Cleveland and many others as well, to try to look at, okay, how do we start to address and create some critical strategies that we're going to address these things in the broader neighborhood, in the broader context. And one of those solutions was creating some green space, about a 12-acre park on our main campus as part of our $1 billion investment.
Yeah. And I see one of our colleagues in the chat from Ascension also talked about their kind of large scale investment in terms of some construction in their community and using that work to really think about it from that sustainability and environmental equity lens as well. So I guess if we think about, and as we've talked about, if we define environment or even energy and access to energy as a social determinant of health, Greg, you started to comment on this, so I'll kind of turn the question back to Angela and Coletta. Thinking of environment and energy as a social determinant of health, how does that change who we might be thinking about partnering externally with, or how do we expand our external partnerships that have been more traditionally focused, I think, on the more proximal causes of health disparities? So Colette, I'll turn it to you first.
Well, one of the things that I think you used a great term, de-siloing, because we can often find ourselves, in our own space, and intentionally breaking those down is really important. One of the things that we did as a ministry, and I would encourage you to take a look at your state, is, do you have medical legal partnerships? MLPs are phenomenal resources to pull into collaboration with healthcare in addressing these social determinants of health of an environmental cause. Dr. Thompson talked about asthma. That is the one that's the one that was a cornerstone for us getting an MLP here in Baton Rouge, was how to deal with these kids that kept cycling through, were very familiar faces with us, because of the environment that they were living in and the inability of them as an individual to influence the landlord to be able to take care of what was required to be taken care of by law and statute. And so an MLP is an example of breaking down a silo, going outside of healthcare, partnering with another sector to address an environmental issue that has upstream impact for healthcare. The mold, the rodents, all of those things are just terrible for these kids and families to live in, and yet that's the environment that they found themselves in. So that's just one example of how you can use partnerships to address social determinants of health in the environment.
Yeah. Angela, how about you? What are you seeing at Christus?
So we have a fund called Christus Fund. And every year it's an annual allocation that allows us to award grants to organizations in the communities so that they can partner with our hospitals. What we did this last year is added environmental stewardship as one of the areas to address social determinants of health, so that other organizations could be a part of that awardee process. So over this past year, we've been able to award right now $150,000 to 3 organizations, one of which is addressing food deserts, which is a big issue. And so they're partnering with a food project organization in expanding and making more healthy fruit and other foods accessible in these particular communities. Because prior to that, as you are well aware, Family Dollar is not necessarily the only place that we want people to have access to food. And so, making sure that they have access to fresh fruits and vegetables, and being able to kind of and being blessed with the opportunity to put money towards that has been a really big benefit.
Yeah.
And Nancy, just to jump in, there are other organizations in your state that you may not be aware of. There are groups called Rebuild, and like there's Rebuild Louisiana, Rebuild Baton Rouge. I would encourage you to look at those, because their goal is to help go in and rebuild the environment. So when disasters occur and people find themselves with homes that have been flooded or things like that, these organizations have gone out and done the fundraising like Angela talked about, and they've put together resources to help go in and rebuild families. Those are other organizations just reaching outside of healthcare to see how you can help support with environment.
Greg, when we were talking, you were the one who brought up the term energy inequality as something that should be, kind of part of the larger built environment or climate environment, or climate, effects on individuals. How are you thinking about energy inequality in terms of the work that Metro is leading in the greater Cleveland area?
So again, this for us, it really involves the issue of housing, and looking at it from housing from a health perspective, but also an economic perspective as well. And if we really want to try to address these, social determinants of health issues, these socioeconomic factors, looking at housing through these lenses, and as you said, energy as a social determinants of health. And one of the things that we know in the neighborhood that we serve here on the near west side of Cleveland is that many of these homes are, dilapidated and, over 100 years old, and the most energy inefficient houses in the city. And so if we're going to make investments in rebuilding our housing in the community, we need to make sure that we're developing housing that really is geared towards addressing those that are facing the biggest burden from whether it's utility bills or whether it's from suffering from heat shutoffs or things of that nature. So trying to look at ways of partnering with housing agencies that we can provide and create quality, affordable housing units that are energy efficient and are providing safe and healthy housing solutions for the people that are most at risk.
So, and I think sometimes when we think about climate and the differential impact of climate, we often think of our coastal regions, like where you live, Colette, and the differential impact of big weather events like hurricanes. And yet there's this day-to-day change that's happening and affects folks in all sorts of regions, including, Northeast Ohio, where we had the polar vortex a couple of years ago and have had continued warming summers, so that even in the summertime, if you are energy insufficient, you're at risk for poorer health outcomes. So, when you think of the community assessment process, and I guess this is an open question to any of you, what are some of the new things or new areas that we should be assessing in terms of climate or built environment that should just become part of our general community assessment process that we're doing at least every 3 years, if not more often?
That's a really, really, really good question. And I'd like to share from two different perspectives. There's after Katrina, we identified a new at-risk group, and it was the electrically dependent group. People who were living at home on ventilators, other types of dependency on electricity. And when that's interrupted, it's what is the process by which they have rescue plans, right? And so, identifying and working with our energy companies to where our electrically dependent patients are registered. We know who they are. We know where they are. We know what their dependency is about, so that when there is a disaster, not only do we get concerned about how, what's your plan? How are we working with you from a case perspective? But it's also, prioritization of where the grids go up faster, where they go up quicker, because where we have a concentration of electrically dependent people, they'll put a little bit more focus on how do we restart there. So that's something we do in collaboration with the state. And I think that it's something that we learned the hard lesson on during Katrina. On our community health needs assessments, your 211 organizations in your states and in your communities are a phenomenal resource of data and information. And you also have other resources in privately held organizations and companies that do social determinants work. They are rich with information and data about people who are vulnerable. If someone's contacting you because they need assistance with paying their electricity bill, or they need assistance because they don't have central or a window air, an air conditioning unit, there is a rich database of potential people that we need to be aware of. And so how we map that a few years ago, we actually took that kind of information and mapped it to see where we had pockets of vulnerability after the 2016 flood, where we had 60% of our communities of color were underwater in our city. And so, you know, mapping where people were, how many of their applications for electricity were applied for to be turned back on. If you don't have your electricity turned back on, you've not been remediated yet. And so understanding where the great need was. So thinking about where those other potential sources of data and information are to help us where to focus, go outside of healthcare. And we just have to think differently to go find where the need is.
Yeah.
One of the things that we've also started to look at is public transportation. You know, here in Cleveland, you know, one of the biggest contributors to pollution is automobiles. And especially when we're serving, you know, an underserved population that really does not have access to automobiles, investing in public transportation is a major issue. And so we're working with our regional transit authority to help to make improvements on the main bus line that goes through and touches many of the neighborhoods that we serve, to look for ways that we can enhance that and make that a more convenient and reliable source of transportation for our patients and our employees as well.
Yeah, and you know, transportation is really interesting, and it's certainly something that we've seen be an important part of talk about emergency response planning with COVID, right? You know, really understanding who has access to go where and at what time of day and then what schedule. It's been really essential in many communities to figure out, where are we going to put immunization clinics? Where are we going to put testing centers? So, you know, so that's an important part of the built environment, and depending on the time of year, you know, the climate impacts that you have to take into account in terms of, you might have a bus available, but if it's icy outside, you can't and don't want your seniors to be getting on it. You know, is again part of that intentional focus of environment. Angela, did you have something you wanted to jump in on?
Yeah, sorry about that. But I wanted to also mention, with Christus, we actually have mobile units available, mobile clinics that go out to the communities because of the barrier of transportation, and because our goal is to remind folks that just because you live far doesn't mean that you are not entitled to equitable health care. And so I know we have a mobile unit in our Texarkana ministry, one in Corpus, and I believe one in our San Antonio ministry. And so those mobile units are available, you know, to do that outreach, of course, contingent upon weather, but again, addressing that barrier of transportation for our populations.
Yeah. So one of the things we talked about, you know, as we were planning for this session is how organizations can and should be taking a more integrated approach when we think about societal factors that influence health or social determinants of health, so that what we assess for and are working on improving on in our communities informs and links to what we look for and identify in terms of our patient needs. And then kind of that third loop, or that closing the loop, is how are we supporting our own caregivers, our own team members?
Right.
So I'm interested in how your organization has been thinking about employee health and support of your team members and their families and environmental impact. And has that caused you to take any different types of actions? So Colette, I'll start with you, since I'm just going around the loop on my screen, just to be clear.
Sure. That's a great question. You know, our institutions, our healthcare institutions, truly are anchors in communities. When you think about, sometimes we are the largest employers, even in small rural communities, the hospital is going to be a larger employer. So making sure that we care for our teams is caring for the community as well. And so some of the things that we've done with a special focus on team member is, you know, your health is a lot more than just physical health. We know that
Yes.
through the social determinants. So screening for social determinants to know what are the barriers that are going to get in the way of someone being successful at work is another way to look at how you do these types of screenings. And what we found out when we started digging into the data about our team members who found themselves upside down financially and needing assistance in an emergency was that 26% of our team members were caught in a payday lending hell. This very vicious cycle of borrowing money in between pay periods to pay a bill and paying these exorbitant, ungodly interest rates and fees. And so therefore, we became part of a solution. As the legislature, some states have caps on payday lending. And thank God if you do, make sure you preserve them. We unfortunately do not. And so when our legislative attempts failed to put a cap on payday lending, we became part of the solution. And so one of the things that I would ask every single one of us on this call here today is, do you know in your institutions where the unspent funds from your dependent care and your medical savings accounts go? You have a TPA, a third-party administrator that oversees that. And at the end of their audits and at the end of that, they transfer those funds back to the organization. It cannot go to the individual. That's the tax law, but it goes back to the organization. You may be surprised to find out how much of that is left over at the end of each year. Wow. And 3 accountants down in your organization, someone's making a journal entry that this is what goes into the books. And if you asked your CEO or your CFO to redirect those funds to team member assistance and team member programs that prevent your people from getting into those types of situations, what a win-win. It's team members helping team members. And so that's how our work got seeded and funded. Way back in 2006 is when we started that process. And so it's been around for a while. Unspent dependent care funds and unspent medical spending funds. And so that there are also organizations out there, Pay Active, there are some others like that, that actually in the in-between cycles of your payroll, team members can get their own dollars based upon rules that we put in place. Gosh, that is dignity in work. No one is asking for permission to access what has already been accrued or is rightfully theirs. That is such a dignity in work thing that you can do as an organization, is to afford them the opportunity to access those funds in between pay cycles. Those are just some of the financial health programs that we've put in place that we believe addresses the social determinants of health where it comes to economic stability for our teams.
That's great. So I guess I know we just have a few minutes left. I first want to ask Angela, early on, we had a question for you of someone just wanting a quick overview of what's the virtual reality experience for seniors that you talked about.
Oh, okay. Yeah. So we awarded a grant to an arboretum, and they actually provide a virtual reality experience for seniors that want to come and study and understand the environmental impact of clutter in the ocean, and understanding, what that does to the fish and the other life that exists underwater. So that's the experience. They film underwater and are able to provide, goggles for the seniors so that they can, better relate to the fact that, littering in the ocean is something we definitely want to steer clear of, and how important it is that we not only pick up, the trash on the sand, but be mindful of what is floating in the ocean and how that impacts all of our wildlife.
Oh, that's very cool. It's something that actually all of us could use.
Yeah, the arboretum, the aquarium, I'm sorry.
Yeah, great.
Yeah.
And so Colette, you've talked about, one focus on employees. You just shared with us this great idea in terms of focusing on sustainability and via a virtual reality experience. Greg, any kind of last minute advice on 1 or 2 things folks can take back as we get ready to rejoin the big room.
Yeah, sure. So I mean, I think, you know, to the points that were mentioned earlier is, you know, look at ways that, you know, your mission of your organization that you can already fit into, and look at how these, you know, initiatives or programs or partnerships that fall in line with that mission can help to advance some of these concepts, and look for the low-hanging fruit, and to kind of prove out why some of these initiatives are so critically important, and really how it can open up a new area of funding, grant opportunities, and new partnerships.
Great. Thanks all who've stuck with us through this breakout room.